At Cook Children's, we are more than one of the largest fully integrated healthcare systems in the country. We are a beacon of hope, a place where every child receives the care they deserve. Our commitment to doing everything for the child is unwavering. To fulfill this promise, we are excited to announce the beginning of a significant expansion project, which includes building a new West Tower on the Fort Worth Medical Campus. By embarking on this West Tower project, we are creating a brighter future for our children. This expansion is more than bricks and mortar. It is a symbol of our dedication to this region. We are excited to see this project come to life and to continue doing everything for the child.
It is an exciting time to be associated with the Cook Children's Healthcare System. As our community continues to grow and expand, we are growing and expanding to meet the needs of the children in our community as we continue our promise of doing everything for the child. So where I'm standing is right in the middle of the new West Tower. Now let me tell you a little bit more about what this master plan entails. Directly behind me is our South Tower, which has our emergency department, perioperative services, heart center, med surg, and even our behavioral health center in the tower behind me. Now, with our West Tower, we're going to attach that to the South Tower. Now, in order to do that, we actually have to close 7th Avenue. So we can create a contiguous emergency department in the future, as well as some of those support services. And as you go up the building, all of those floors will connect. So perioperative services is going to expand. And so perioperative services goes ahead and expands on the 2nd floor. Our heart center is going to expand. It expands on the 3rd floor. And then on our 5th floor, we have med surg and we have an ICU going in. So they'll connect throughout the building, making a loop around the campus. With any big project, there are a series of smaller projects which are called enabling projects. One of those that we have for this project is actually moving our Kids Place daycare. We're moving our Kids Place daycare west of 8th Avenue, and then this becomes green space for everybody to enjoy. We have parking spaces over here. We put in a new power plant over here, and then on the other side of the green space, we actually have a new parking garage that'll serve patients and families. So being with a pediatric organization, we like to play with toys, and so this is one of our planning toys. So this is a 3D model that we have of what the campus is going to look like. So we went and walked and saw the existing space, what it looks like today, and then I want to walk through just what it's going to look like in the future. As I said, from a schedule perspective, we're going to be impacting the campus for the next several years. So it's 5 to 6 years before all this work is done. It didn't take nearly that long to build the model, but I wanted to walk through what those elements of what we're calling the master plan really is for this particular point in time for Cook Children's Healthcare System. So this is the power plant expansion that we talked about. That's just there to make sure that we have enough power and that we have enough air conditioning to make sure that we can get everything done that we need to do. Now there's a lot of enabling work and utility work that goes on. In fact, one of the things that we're doing is we're rerouting all those major utilities. So you think storm lines, water lines, power, even internet lines, all of that has to get moved from over here. And so we're actually going to be tearing up the street all the way down to Rosedale on 8th Avenue. So the power plant, while it's not the most interesting thing for most folks, it's very, very important. As we were looking at the Kids Place site, that is going to be replaced right here where Kids Place is today. So Kids Place is one of those enabling projects that it will be moved over across west of 8th Avenue. That's part of the identity of who Cook is, taking care of kids, taking care of the families. So we want to make sure that we have that. That just has to move. That is that first domino to fall. But this will be a nice green space. And next to that green space, we actually have to have that new garage I was talking about where Alliance for Children is today. So that building comes down and we create a new patient and family garage experience. So patients and families that are going to be coming into the West Tower have a place to park. Now you'll see a little connector that we have. We have a couple connectors throughout. So there will be a connector that connects from the 3rd floor of this garage to the 2nd floor of that West Tower. So families will present in this garage, they'll be able to come over and then they can distribute throughout. Now for staff, since we do have this staff garage right next to it, we will be having a tunnel that goes underneath Terrell. So that is for staff only. So staff can actually connect through the tunnel system that we're creating. So we have that tunnel that connects the South Tower to the North Tower, and then the West Tower to Dodson. We'll have an underground tunnel for staff to connect because, as I mentioned before, the campus is getting really big. There's no way around it. I mean, the campus goes all the way from 6th Avenue all the way to 8th Avenue with patient care services. So as you come around here, this is where we get to the West Tower that we talked about. The West Tower over 700,000 square feet, new programs that are going in. We're going to have 3 basements in this particular building. So it is a large building. And one of the points that I wanted to make, just from a growth perspective, the entire campus that we went and walked outside, including parking garages, is about 2.5 million square feet total. And we're going to be adding a little over 1 million square feet to that campus with this one project. So it's very significant. The 1 million square feet that we're adding is program space. Really, the vast majority of that is program space there to deliver patient care. Now, one thing that always gets asked of me is, are you building for the future? And yes, we are. While this tower is over 700,000 square feet, we have about 160,000 square feet of shell space. Now, what that means is, as we're going through the programming of everything that has to go in this tower for this campus, because if you look, the campus is very built out at this point in time. We want to make sure that we had the ability to continue to expand services and continue to serve that growing population here in Fort Worth. So we have shell space within that building as well, large chunks of shell space that we can actually put inpatient beds in and things of that nature as the needs arise. So as we've spent a couple years going and analyzing all the different service lines that Cook Children's has and how close they are to capacity as we project out over the next 10 years or so. When we do that, we also fold in new programs that we want to add. So like with this West Tower, we're going to add programs to our portfolio. We want to make sure that we have the capacity to do that. And all of those numbers and metrics that we work with the planning department, we work with finance, we work with the clinical leaders, we work with the admin staff, intimately over here at the medical center, say what's coming next, what's new, and where are those pain points. That's really how this master plan was developed. The master plan wasn't developed in a vacuum. It was done how we do everything here at Cook Children's, with a lot of collaboration and with a lot of input into what we want to do and how we want to grow. So really what kicks off that master planning piece is we look at what are the needs in the community. And you know, I moved to Fort Worth a little over a decade ago, and Fort Worth looked very, very different at the time. And as we do a community assessment, or we look at what we're trying to accomplish for the different populations, it's not just Fort Worth. Our reach here at Cook Children's has continued to grow and to expand all the way out into West Texas. So there's so many different areas and regions that actually come and feed the medical center, but there's still more to come. Let me tell you a story just about how remarkable the experience is for patients here at Cook Children's. I was waiting just inside the vestibule at Cook Children's, and there was a child, a small child, probably 1.5, 2 years old. And the child was fighting coming in, was crying and screaming. And as soon as that child came into the hospital and saw that experience, their mood automatically changed. And it was amazing to me. The mom, she came up, she apologized. She said, "I'm so sorry. My son has spent a lot of time in hospitals in his short life, and so he's scared. But as soon as he came in, he started pointing at things, started showing, hey, you know what, he was comfortable." And that's what we're trying to create here at Cook, so that everyone that goes into direct patient care, that they can do their job and deliver that world-class care. And we're just trying to provide that world-class space. Hopefully you can see from this that this is a transformative project for Cook Children's and the children that we serve. This is a wonderful opportunity, and it's really an exciting time to be at Cook Children's, where we are continuing to grow. More is coming, which is very exciting as we continue to do everything for the child.
Our place in this world is to be there when kids need us, and to provide that necessary support for that family and that child so that they're able to have as productive of a life as they possibly can. Pediatric healthcare is incredibly complex. We need to be able to provide the highest level of care while also addressing the unique emotional and developmental needs of our young patients. The support of our community is essential in our mission. Their generosity allows us to invest in cutting-edge technology, recruit top talent, and provide compassionate care to every child. Kids and families rely on us and have for more than a century, and we want to make sure we're in a position to continue to be a beacon of hope where every child receives the care they deserve now and for generations to come.